So this is anterior superior iliac spine. Okay, why it is called as anterior superior?
It's lying anterior side.
Lying anteriorly,
Superiorly, iliac
bone का part है and it is a projection,
Spinous
spine-like projection. Okay, or it lies at the level of L3, L4 vertebrae. Now this is the posterior superior iliac spine. Do not confuse with this. Okay, this is posterior superior iliac spine, and it lies at the level of S2 vertebrae, and it is demarcated on the surface of the skin by a dimple. Okay, and it is lying about 4 cm away from the midline. So that dimple, it demarks deep to it. There is a location of this posterior superior iliac spine. Clear? Now when you will trace this anterior border, you will go downwardly towards the acetabulum. This is the extension of the anterior border of the ilium. From the anterior superior iliac spine up to the acetabulum, this is the anterior border. Upper end has anterior superior iliac spine, then it has a notch, then there is another elevation, and this is called as the anterior inferior iliac spine. Okay, so we have 2 iliac spines on its anterior border. One is anterior superior, another one is anterior inferior. These are the important landmarks here for the attachment of the muscles. Okay, अगर ये नहीं होता, if there is only one, so the name will be anterior iliac spine. But we have 2
superior inferior.
So it is anterior superior, anterior inferior iliac spine. Then start with the posterior border. It starts from the posterior superior iliac spine, and it will extend up to this greater sciatic notch, upper part of this greater sciatic notch. This is the posterior border. When you will trace this posterior border, posterior superior iliac spine, then there is another notch, and then there is another elevation which is called as the posterior inferior iliac spine. So these are the borders and the features. Superior border, anterior border,
posterior border.
Then there is one more border which is called as the medial border, and which is on the medial surface. So this border is called as the medial border, which is separating the iliac surface. This surface is called as the iliac surface. Okay, which is separating the iliac surface and the sacroiliac surface. Okay. So this rough area, it is the sacroiliac surface, which is a demarcation line here. That is the medial border. So we have
rough surface कौन सा है?
Sacroiliac. Sacroiliac क्यों? एक तो ये ilium bone का part है, and the sacrum is related to this surface. That's why it is called as the sacroiliac surface. Clear? Now coming to the surfaces of the ilium. Okay, it has lateral surface, it has medial surface, and it has posterior. So this is anteromedial, this is posterior-medial. Entirely this surface is lateral surface, and this is also known as the gluteal surface. Okay, why this lateral surface is called as the gluteal surface? Because the muscles of the buttock, they are called as the muscles of the gluteal region. They are attached to this surface. Okay, that's why this surface is called as the gluteal surface. And here this surface is called as the pelvic surface or iliac fossa. Here is a muscle with the name of iliacus. That muscle is attached here. That's why this surface is called as the iliac fossa. And posterior to the midline, there is another surface which is called as the sacroiliac surface. So this is about the borders and surfaces of the ilium. Is there any doubt? Everything is clear?
Yes, ma'am.
क्या बेटा anterior border, anterior superior iliac spine से कहाँ तक जाएगा? Acetabulum तक. Now this is the posterior border, which is from the posterior superior iliac spine up to this greater sciatic foramen or notch. Okay, and the anterior superior is more prominent than the posterior one. How you will identify the posterior one? With the help of the sacroiliac surface. Clear? Okay. So this is about the ilium. Now we will discuss about the pubic bone. So this is the thin bone, okay, which is lying antero-inferiorly, somewhat quadrangular in shape. It has a body. This is called as the body of the pubic bone. Clear? Now how many surfaces it has? It has
lateral
this surface which is lateral. it has this surface which is medial surface, and here it has a border which is called as the superior border. This border here is called as the inferior border, and here this surface is called as the symphysial surface, which will form a joint that is called as the pubic symphysis. This pubic symphysis, it is a variety of which joint? No, it is not a fibrocartilage. Symphysial joint. All the symphysial joint, they are the category. Symphysial joints means they are in the midline. All the joints in the midline, they are in the category of secondary cartilaginous joint. Clear?
Yes, ma'am.
So this is a secondary cartilaginous joint. So what happens here, if you have any bone in your viva, okay, कोई भी bone अगर पूछा है, so if any joint is formed at that bone, so you should have to knowledge of that variety of the joint. Okay, ऐसा नहीं है कि आपको joint के नाम ही नहीं पता है, ये तो आपको आना चाहिए. This is automatic कि आपको पता होना चाहिए कि hip bone, it is forming the pubic symphysis, as well as it is forming your hip joint, and these joints, they are the variety of this. Clear? So this is about the pubic bone. It has lateral surface, it has medial, and it has symphysial surface or pubic surface. Okay, ये वाला pubic surface नहीं, symphysial surface, which is forming a joint.
Superior surface.
Superior border बोला
Border, yes, superior border.
Okay, and it has border, superior border and inferior border. Now this is the lateral surface. Body का lateral surface है, and this lateral surface of the body is also called as the femoral surface. Okay, because you can see in our body when at the position of this hip bone, this ilium, it is in the gluteal region, and you can see this comes in the thigh area. That's why this area, this surface is called as the femoral area here, and here this is called as the pelvic surface. Why? Because inside we have the pelvic cavity here. Okay. Then this is the symphysial surface. Border, it has superior border. This is the superior border. This is the anterior border, and this is the posterior, and here this is the inferior border. Okay. Look, अभी इसका केवल superior surface पे stuck रहो. Superior border. This is the superior border. You will see a border from the upper end of the symphysial surface. It is running posterolaterally up to this elevation. The name of this elevation is pubic tubercle. Okay, so this is the pubic tubercle, which is the important landmark here. Okay, pubic tubercle, where you can find the pubic tubercle at the lateral end of the superior border of pubic bone, and this superior border is called as the pubic crest. Okay, this is called as the pubic crest. Superior border of the pubic bone is called as the pubic crest, and its lateral end has an elevation which is called as the pubic tubercle. Clear? Now we have an extension here. You can see this one. This bony bar, it is called as the superior ramus of the obturator foramen. So this superior ramus, it is the extension from the pubic bone, okay, and it is forming the superior boundary of this obturator foramen, and it is going towards the acetabulum. Okay, can you see this eminence here, this rounded elevation area? This is called as the iliopubic eminence. This is iliopubic eminence. This eminence. So this superior ramus, it is coming from this pubic bone from the posterior part, and then it is going towards the eminence, and it will end here. So this is the superior ramus. Now this superior ramus is important here. You can see the superior ramus has borders and surfaces. So this is the inferior border of the superior ramus here, which is forming the upper boundary of the obturator foramen. This is the superior inferior border. Okay, then it has this border and this border. This border is called as the, which is extending from pubic tubercle, and it is going up to the pubic eminence. This border is called as the superior border. Okay, then there is another border which which is posterior to it, extending from pubic tubercle, and it is going posteriorly up to this line. This line is arcuate line, okay, and it will form the complete arcuate line here. This border is called as the pectineal line. क्या कहते हैं इसको?
Pectineal line.
And this is also known as the pecten pubis. Okay, this is called as the pectineal line because there is a muscle with the name of pectineus which is attached to this border, and it is called as the pectineal line or pecten pubis. Clear? हाँ, तो ये हो गया एंटीरियर बॉर्डर, इसको मैंने शायद सुपीरियर बोला पहले ना. दिस इज द एंटीरियर बॉर्डर, this is the superior border which is also known as the pecten pubis or pectineal line, and here it has the inferior border which is forming the upper boundary of the obturator foramen. Now this superior ramus of the pubic bone, it has surfaces. Anterior surface which is called as the femoral surface. This surface is called as the pelvic surface, and here you can see this triangular surface which is present between the anterior border and the pectineal line. This is called as the pectineal surface. This triangular, this is very important landmark again, pectineal surface. Okay, so this is about the pubic bone. So what we have studied in the pubic bone, the body of the pubic bone, it has lateral surface, it has medial surface, and it has symphysial surface. Lateral surface is called as the femoral surface, medial surface is called as the pelvic surface, and this is the symphysial surface. It has superior border here which is called as the pubic crest. At the lateral end of the superior border we have the tubercle. Okay, then here is an extension here which is called as the superior ramus, which will extend up to the acetabulum, okay, at the iliopubic eminence. Then it has inferior border, anterior border, posterior border here. Okay, anterior border, superior border को ही pectineal border क्या है, ठीक है. तो इसमें ये हो गया. बाकी एंटीरियर, सुपीरियर एंड इंफीरियर इधर से भी पूरा वेल डिमार्केटेड है. एंड दिस इज एंटीरियर सरफेस, दिस इज सुपीरियर सरफेस विच इज ऑल्सो नोन एज द पैक्टिनियल सरफेस, दिस इज प्यूबिक सरफेस एंड दिस इज द इंफीरियर सरफेस. सो दिस इज अबाउट द
pubic surface.
okay. Now there is another extension which is going posteriorly towards the ischium. The anterior half of this inferior ramus is made up of the pubic bone, and the posterior half is made up of the ramus from the ischium. So the name of this bony bar, it is called as the ischiopubic ramus. Half part is made up of ischium, half part is coming from the pubic bone. Okay. Now coming to the ischium. This ischium, it is the thick and massive bone here which is directed posterior inferiorly. Okay. Now this ischium, it has anterior border which is forming the posterior boundary of the obturator foramen. This is the posterior anterior border. Now it has this well demarcated border which is called as the posterior border. Okay. Now how many surfaces it has, and this is called as the lateral border here. So how many surfaces it has? Lateral surface, posterior surface and medial. Lateral is called as the femoral surface, medial is called as the pelvic surface, and here this is called as the ischial surface or posterior surface. Clear? Now this posterior surface, it has on its lower end it has a very prominent tubercle which is called as the ischial tuberosity. दिख रहा है? This very prominent end is called as the ischial tuberosity. Now what happens? This entire posterior surface of the ischium, by this oblique line, you can see this oblique line, it is dividing into superolateral and inferomedial part. Okay, एक सेकेंड. हाँ, ये वाला जो लाइन है, ओके, सुपीरियर और इन्फीरियर पार्ट में डिवाइड हो रहा है. देन इन इट सुपीरियर पार्ट इट हैज़ एन ऑब्लिक बॉर्डर विच इज़ डिवाइडिंग इट इनटू इन्फीरोमीडियल एंड इन्फीरोलैटरल पार्ट. In the lower part it has a longitudinal border which is dividing into medial and lateral part. So let me draw this diagram. वो कहाँ गया मेरा वाला पेपर? Okay, hello. Boom. Okay, this is the ischium. Okay, at this point we have the ischial tuberosity. Now this entire ischial tuberosity, entirely this, by a transverse line it is dividing into upper and lower part. Okay, now the upper part has the oblique line. You can see this is the oblique line. okay, which is dividing this upper part into superolateral and infero-medial part. Now its lower part has a longitudinal line here, which is dividing the lower part into medial and lateral part. Clear? Why this is important? Because the muscles of the posterior compartment of the thigh, that is the hamstring muscles, they are arising from this ischial tuberosity. Okay? So at that point we will use this muscle is arising from the superolateral part of the ischial tuberosity, infero-medial part of the ischial tuberosity, or
inferior-lateral.
Lateral part of the ischial tuberosity, lower part ka, and medial part of the ischial tuberosity from its lower part. Clear? So that's why you have to remember the division of the ischium, and these divisions, they are according to the attachment of the muscles. Okay, that is divided because the muscle is attached to it. Okay, due to the attachment of it. क्या होगा तेरे को? 4 घंटे बाद आ. Okay, so this is about the ischium. The upper end of the ischium, it is forming the 2/5 part of the acetabulum. So you can see here all the 3 parts of the hip bone, they will join here at this point, which is called as the acetabulum. 2/5 part of the acetabulum. Upper part is made up of ilium. 2/5 of posterior part is made up of ischium, and 1/5 part is made up of pubic bone. Pubic. Clear? Now this is the ramus, inferior ramus. Yes, which is
Joining of pubic and
the ischium. कोई नहीं होता है,
Iliopic
टूटेगी नहीं. ठीक है. So this is superior border. This is the inferior border. The superior border of the inferior ramus, it is forming the inferior boundary of the obturator foramen, and the inferior border is this. Between these two border, it has 2 surfaces, lateral and medial. Lateral is femoral and medial is pelvic surface. Clear?
Yes, ma'am.
अब पढ़ लेना एक बार. Okay, so if you will hold the this hip bone in the anatomical position, you can see the pelvic surface of the pubic bone. It is forming the anterior boundary. The pelvic surface of the inferior ramus, it is forming the lateral boundary of pelvic cavity, and this is also forming the lateral boundary of the pelvic cavity entirely, and this is forming the anterior boundary. Because the pelvic cavity, मृत्युंजय, is here something important? तुम्हें लग रहा है वीडियो बन रहा है तो ठीक. So this is about the hip bone. Is it clear? हाँ, बड़ा आपको लग रहा है, but try to study it in a form of separate part. वाइवा में ऐसी बात पूछेंगे like this is the bone.
वाइवा में ये नहीं पूछेंगे superior border, inferior border.
अगर पूछ लिया, this is the obturator. What is the name of this foramen? So elaborate the boundaries. तो अब बोलोगे ना, जो दिख रहा है वो बोलेगे ना. Superiorly it is bounded by the lower part of the acetabulum. Anteriorly it is bounded. Anterior-superiorly it is bounded by the superior ramus, or posterior-inferiorly here it is bounded by the inferior ramus, and posteriorly it is bounded by the anterior border of the ischium. अगर पार्ट सारे पता हैं तो you can identify the boundaries. अगर आपको यही नहीं पता कि this is the superior ramus, this is inferior ramus, then how you will explain the boundaries? है ना? तो to explain any boundary, you have to study this bone entirely. Okay, you have to study about the parts of this bone. Okay, so ilium, you have to study it separately, then pubic bone, and then ischium bone. Okay, now coming to this is called as the acetabulum. बता दिया how it is formed. Okay, now you can see it has this boundary here. Okay, but inferiorly it has, between these two boundaries there is a notch. You can say inferiorly the boundary of the acetabulum is deficit. Okay, so this area is called as the acetabular notch. Deep to it, it has a fossa which is called as the acetabular fossa. The margin of the acetabulum, they will participate in formation of the hip joint. This deep part, it will not participate. This is the non-articular part. Which part? Acetabular fossa. This deep part. Okay. The femur, the head of the femur, if it will articulate with the acetabulum, it will only articulate with its margin. If you will see the diagram of the acetabulum in the book, it is horseshoe shape in appearance. It is like this. Okay, this is the acetabular notch. This is the margin where the femur is attached, which will form the hip joint. And this middle area, which is here, this deep part, it is called as the acetabular fossa, which is filled with fat, which is called as the acetabular fat. So that here it can prevent the friction of the bone and it will act as a cushion for the joint. Clear? So this is about the hip bone.